Hey again, in this video we're going to look at how to create disease models. So we're going to go into detail on what it means to create a disease algorithm and how to create it on the Open Health platform as it stands. So first I'll go to my homepage. I'm going to always start from the homepage. The link is open.elsa.health. I will go to explore disease models. Okay, it's loaded up some of the disease models that currently exist. If you want to, you can click on them and see each one of them. So this one was made by Kelvin about a month ago. We'll click on that one and we can see there it is. And here are the contributors to contributing accounts. And we can test it out down here if we want to, but we'll save that for another video. For now, we're going to click on create new model or algorithm and choose a condition. So we're going to model tonsillitis. There it is. And the model nickname. So this is, we give each model a nickname so that we can differentiate two different tonsillitis models. So I'm going to call this one test tonsillitis model. I can never spell this right. There it is. If this condition has multiple stages, I will check this box and I can say there is primary infection. I can add another stage, secondary infection, etc., etc. But for now, we'll assume we'll just go with a simple model that doesn't have any stages. Next, we will confirm the data that we've entered there, successfully created. It will automatically bring us to this page here. And as you can see, automatically I am the only contributor to this model, so I can invite other people if I want to, but for now it'll just be me here. And just really quickly, I can also access this model from my account homepage. Here it is. And if here it is, test tonsillitis model. If I click on edit or update, it brings me back here and I can continue working on it. Currently my model is in draft mode. I can change it to published, but we'll stick to draft for now because I don't want it listed yet. I still have to create it. So first thing I'll do is I will create, I'll add some symptoms. Let's just start there. It's a pretty good starting point. I'll add a symptom and my tonsillitis case will have fever. So fever is going to be there. As it tells me here, it's selected fever. Continue. Okay, so for each symptom that we create, for each sign or symptom that we create, we are going to have to go through a series of questions to specify in more detail about how that symptom or sign presents itself, where applicable. In this case, symptom of fever, how often does a symptom occur in the different sexes? So if I had literature to support my findings, I would say that this study of 10,000 patients found that let's say 50% of males had the symptom of fever, while 100% of females had it. But in this case, we'll say it happens all the time for like the symptom of fever doesn't separate or doesn't choose how often it happens dependent on the sex. All right, we'll move on to the next part. So the first question is always a sex question. Second question is going to be on prevalence, on age. So we know some symptoms present differently in different ages, or sometimes the symptom is not present in higher ages. So a good example of this would be failure to breastfeed. That would be a symptom that would be 0 for everybody. I mean, I would expect it to be 0 for senior citizens at least, or adults. But in this case, we're going with fever. And again, in my case, I'm going to make the assumption that it doesn't happen, like newborns don't have fever at all. And infants, only, let's say 16% of them have that. Toddlers, will leave it at 100, children 100. Again, we're just testing things out. I would not recommend you follow my descriptions here. We'll say it's 30. Actually, let me type it out here so we can skip the decimal places. 30% of young adults experience a symptom of fever. So we'll move on to the next one. Again, you can use your keyboard arrows to go back and forth. So as an example, I'm just going to hit the right key now. Takes me to the next one. So we've done sex prevalence, age prevalence. Now we'll do the duration. So on average, how long does the symptom of fever last? So we can say the symptom of fever for a patient with tonsillitis usually lasts about, let's say 7 days, plus or minus 3 days. So it could be anywhere between 5 days and 10 days. Okay. Now, if the symptom lasts forever, as in the symptom will go on until, if there's no intervention, the symptom will just keep going until the patient's death, then we would say the symptom lasts forever by clicking this button, and it would automatically add the number of years that we consider forever currently. But this one is 7 days plus or minus 3 days. Okay, give or take 3 days. Next is we'll define the onset, and it's either gradual or sudden. So this is how rapidly the symptom shows up. And this fever, we can either leave it at 50-50, or we can say it is 100% of the time sudden. So you suddenly get a fever. It's not gradual. Next, the nature of the symptom. So it's either low grade or high grade. In this case, we'll say it could be both. It happens to be low grade 50% of the time, or high grade 50% of the time. Okay. The periodicity of this symptom of fever, we'll say that according to the literature, it could either be persistent, intermittent, or non-specific. And according to what we've read, it is 60% of the time it's persistent, 30% of the time it is intermittent, and 10% of the time it is non-specific. And it's important to note that these have to add up to 100. Okay. All right. So we'll move on to the next symptom, next aspect of the symptom. Aggravators. What are the aggravating factors of the fever symptom? We'll say that crying is an aggravator. Standing up is an aggravator in this case, as well as sweating is an aggravator. We'll leave them all at 100%. They all aggravate the symptom of fever. Relievers, when they take antipyretics, they get better, or when they sleep on it. So we'll leave those relievers as they are. Next is the other interesting part of the symptom description, and this is the time until symptom. So this is how long it takes between the date of infection until the date the symptom first presents itself. Now, symptoms can stagger, so you might get a fever first and then get a rash second and then start vomiting third, whatever the progression is. But here we specify the incubation period, not just of the disease, but of the symptom. So we'll say that from the date of infection, it takes roughly 4 days, 3 days, between 3 and 6 days for the fever to start showing up. Okay, we'll continue. And we'll see our summary here. If we're happy with this, we can just click finish. Again, review it just to make sure that the data is representing what you think it's representing. After we finish, there's our symptom. The fever is there. Now let's add another one, tonsillitis. This is not a great model, but let's say it comes with a cough as well. And this cough doesn't choose the sex. The age prevalence is also exactly the same. And on average, you have a cough for 2 weeks, so that's 14 days. We can say plus or minus 6 days. So it's 14 days, give or take 6 days, right? Actually, let's make it a nice round number, like for a week. So it's 2 weeks, give or take 1 week. So the symptom can go for 1 week or 3 weeks, roughly there. This doesn't mean that 4 weeks is impossible. The algorithms automatically account for it to be less likely, but not impossible. All right, we'll continue. Sorry about that. And we'll just go on from here. We'll say that this sputum is usually, like the nature of the cough is usually dry. And dry happens, we'll say, it could be dry, it could be green, or it could be a combination. So we click on add combination of symptoms. Okay, it could be blood stained and yellowish. Okay, we'll click done. There we go. We have our new symptom there. Right, so it could be either one of these, either dry or yellow sputum, or blood stained and yellow sputum. So between these three, it's or, and within this last one here, it's and. Okay. All right. Periodicity. We've already talked about this. Let's say that the cough only happens at night. So 100% of the time is at night. Now these have to add up to 100, but these don't. Individually, each item can go from 0 to 100, but this one, it's the sum of them that has to be up to 100. All right, we'll go on. Things that aggravate this, we'll say smoke and mold as an example. And antihistamines and cough suppressants make things better. Okay, this one can take up to 12 days. So it takes between 12 days and 16 days to start presenting. Okay, right about the 2 weeks point since the day of the first infection. Okay, since the point of infection. All right, we'll move on. We'll look at our summary. I'm going to assume everything here makes sense, but you should again make sure. We'll finish, and there's our cough. So we can see that. I wish I knew how to draw onto the video. That would be great. But we can see that fever starts the 4th day since infection. So the infection point is at time step 0. Fever starts on day 4, but it could start on day 3 or day 6. So plus or minus 2 days. And now it doesn't mean that day 1 is impossible. The algorithms will just make it less likely. Okay. So we expect you to get a fever first and then a cough just through the separation of the symptoms themselves. Okay. We'll assume that these are the only 2 symptoms that we have, and we will say, well, let's add a risk factor to tonsillitis. And in this case, a risk factor here would be you can search for anything you want, by the way, but I'm going to just use the pre-filtered list here and say extended antibiotic use. And this causes a, let's say 85. This is a causative factor 85% of the time. Okay, we'll save that. You can add as many as you want. Investigation. So when we do a lab test on a patient with tonsillitis, what do we expect to see? So we'll expect the white blood cell count to be slightly elevated. So 85% of the patients will have a high white blood cell count. 10% of them will have a normal white blood cell count, and 5% of them will have a low white blood cell count. These are basically just what I find in literature. Again, these numbers are not researched. This is for demonstration purposes. We can add any other tests that we want to add here, even things that we expect to come back negative. So as an example, if we do an MRDT, I would expect it to be negative. If the patient only has tonsillitis, 100% of the time I'd expect it to be negative. And here, of course, I'm rounding off because even the MRDT test itself doesn't have perfect sensitivity and specificity. So we'll just leave it. We'll just make the assumption that it's absolutely accurate. All right, we'll save those 2, and they show us a summary there. And what we can do is, at this point, our model is fully defined. We'll just go ahead and save it. This button here with the floppy disk saves it. There it is. Done. Saved. Now our model is still in draft mode. Okay, so this means I'm going to open this page in a new tab here. You can't find it here, right? Right, it's not even there at all. So what I'll do is I will come back here and I will hit publish, so that my model is now available to everybody else who searches for it. And if I refresh here, it should be the first model. There it is. Okay, it's updated a minute ago, and it's now visible to the rest of the world. Okay, awesome. Moving down this list, there's an area for you to quickly test the model. So we'll say 18-year-old male with a fever, and we see the assessment on the side here. Let's say that this fever is a chief complaint and it is sudden, so probability increased, gradual, probability decreased, based off of what we entered for the fever, which, as we can see here, was 100% of the time it's sudden. So all factors included. Sudden has that type of change. Periodicity was intermittent, non-specific, relapsing. You can try out different things. High grade, low grade. Since these were 50-50, doesn't move much. Aggravators, can add them. Let's remove those. Relievers, antipyretics. And overall, with just the fever, we're getting 74-ish%, and these filled in data here. And we'll say we'll add another one, cough, just to test things out. It went down because of the rules of multiplying probabilities, but that's beside the point. We will say that this cough was sudden. It happens, I forgot what we said. Let's say it happens only at night. The nature is yellow sputum. Or we can say it is yellow and blood stained. I actually don't remember what the combination was. Yeah, either way, I think it was blood stained somewhere. So yellow and blood stained. Or dry. We can set anything we want for the natures, and again, we can add another symptom here. Let's say vomiting, which is not defined here, and that automatically penalizes the model. If we add another one that's not defined, penalizes the model some more. Okay, so this is a simulation of how it would work in when your model is in use somewhere else. Okay, and that's great. Next video we will chat about collaboration, so how to invite members to your group or to your model, and you can work together on editing and creating the models. All right, that's all for this video. I'm quickly going to unpublish this, and yeah, thank you all very much. I'll see you in the office hours.